Hi, I'm Johnston-Willis. I'm a patient at the Chippenham Hospital, and I go to see Dr. Kim.
My name is Peter Manise, and I'm Jordan's dad, and we've always been patients with Dr. Kim, and I've always enjoyed our experiences at Chippenham.
I have osteogenesis imperfecta, which means I break my bones a lot. I have like a collagen deficiency.
Jordan is about a 14-year-old young lady who has a congenital problem. She does have something called osteogenesis imperfecta. It is a brittle bone disease, and these are the kids who can have frequent breaks of their bones. The brittle bone is a disease where the connective tissue just isn't quite normal, so they with minor trauma, they can break the bone very easily.
A chunk of my elbow had broken off. And then they had to put the pins in to keep it connected to the other bone in the right place so that it could heal back together, or else it would just be floating around there sort of. So I had to take the pins in this elbow and then back out again, and then I had to get the pins in this elbow and then back out again of that elbow. Did that 2 different times.
I've operated on both elbows because of and it's a fairly common injury that kids with osteogenesis imperfecta have, where they break the tip of the olecranon, and then they need to be fixed, which is the elbow area. She's also had a clavicle fracture that we've treated non-operatively, and I think she's had one other injury that we've treated her non-operatively. The family has been great. They have known this diagnosis, and they've treated Jordan as normally as possible. They know that she's going to have breaks here and there, but otherwise she should be able to do most everything that other kids do.
With Dr. Kim and Casey and the team, there's always a sense of assurance that we'll be taken care of, and they've always let us know what's acceptable and what's not, and when we can do things and when we can't. And we've tried not to let it really affect Jordan and what she does. She still rides horses. She takes her ballet. We just got her boot off her foot from her latest break on her foot, and first questions were, okay, can she go back to point on ballet? Can she ride again? What should we do? And Dr. Kim always looks at us a little bit funny, but he always goes through the steps of what we need to do so that she can get back to doing what she loves to do. And so there's always a trust factor there with Dr. Kim and Casey and the team, and really understanding what's acceptable, and so far so good. We've never had a reoccurrence. It's always been something different that comes up. So
I've never had any bad experiences Chippenham Hospital. It's always been really we're usually in and out pretty quick, and everyone's always really nice and friendly. It's always actually kind of nice to come and see everyone, and it's not a very worrisome experience.